Welcome. Happy New Year to everyone. Thank you for joining us today for a special webinar titled Mind-Body Synergy, Using Mindfulness to Enhance Cardiometabolic Health and Lower Blood Pressure. So my name is Frances Sadi, and I am the Associate Director of Non-Degree Programs here at Brown University's School of Professional Studies, where our mission is to empower adult learners and professionals such as yourselves with the tools, skills, and networks that you need in order to change the way the world works for good. So it's a privilege and honor to co-facilitate today's session alongside Dr. Eric Laux, who is the director of the Mindfulness Center at Brown University and also the developer of the Mindfulness-Based Blood Pressure Reduction Program, also known as MBBP. As we begin this new year, many of us are looking for ways to prioritize our health and our well-being. Today's talk is designed to introduce you to an evidence-based mindfulness program that merges the transformative practice of mindfulness with cutting-edge cardiovascular science. So MBBP, as you'll learn, is an 8-week evidence-based program that was developed and tested by Dr. Eric Laux here at Brown University through a multi-stage National Institute of Health research grant that I actually had the honor of assisting with back from 2015 to 2020. So the MBBP program not only provides foundational training in mindfulness-based practices, but also guides the learner to apply those practices directly to individualized cardiovascular risk factors, such as stress, unhealthy eating habits, inactivity, poor medication adherence, alcohol consumption, etc. So over the next hour, you'll learn about the evidence-based MBBP program and how this 8-week course builds on the foundation of the renowned Mindfulness-Based Stress Reduction, or MBSR course that was developed by Jon Kabat-Zinn. And so it is an adaptation of MBSR, and MBBP adapted from MBSR applies mindfulness in targeted ways to support cardiovascular health and inspire a healthier, more balanced life. So whether you are here to explore mindfulness, improve your cardiometabolic health, or take a meaningful step towards positive life changes, we're really thrilled to have you here with us today. So just a moment, I'm going to hand things over to Dr. Eric Laux, who will be presenting on MBBP. And then after the presentation, I will just spend a few minutes talking with you, presenting to you some of the mindfulness program offerings that we have coming up here at the School of Professional Studies. But before I do that, just 2 quick housekeeping items. First, we welcome your engagement. So at the end of the presentation, we will open things up for question and answer. Please do feel free to send us your questions and thoughts using the Q&A feature found at the bottom of your Zoom screen. You could also chat to us directly through the chat feature, but for any questions, we do ask that you send it to the Q&A feature. And second, we are recording today's session. We'll send out a link to the recording later this week by email, so don't feel like you have to take notes or remember everything that we're saying here today. You can definitely reference that later on. And of course, we also welcome you to share the recording with friends and coworkers and loved ones and anyone who you think might benefit from hearing about a program such as MBBP. And with that, I am honored to introduce and hand things over to my friend and colleague, Dr. Eric Laux, who is a leading expert in cardiovascular health research and mindfulness here at Brown University. Eric is the founder and director of Brown University Mindfulness Center, which is a leading hub for mindfulness research and education. He's a professor, researcher, author, and pioneer in the study of mindfulness and health, and he's developed impactful adaptations of mindfulness, such as Mindfulness-Based College for Young Adults, as well as the MBBP program that we'll be exploring more today. Throughout his career, Eric has taught at Harvard, McGill, and Brown Universities. But beyond his impressive accomplishments, I really deeply admire the way that he embodies mindfulness and uses it to guide his decisions with clarity and with care. And so with that, Eric, I'm going to hand things over to you. And if you don't mind, I was actually wondering if we could start off today's talk, just hearing a little bit from you about how you came to mindfulness and where you first came up with the concept for MBBP.
Sure. Yeah. Thank you, Fran, for all our years working together, and really nice to connect with everyone online today too. Looks like we've got about 239 people here right now. So really welcome each and every one of you. And I'll give an overview of some of the science, but also we'll have some opportunity for mindfulness practice and just some discussion too. Um, in terms of like how I came to mindfulness and came up with the program. Just like super briefly, when I was in my first year of college, first semester actually, my grandfather passed away of a heart attack. And I was very close with him, and he was pretty young. And so it really alerted me to heart disease and stroke, and learned that a number of my family members had died pretty young, and that it was the number one cause of death in the world. It still is. Uh, and so it was at a time in my life that I felt like this is really something that I could contribute to. It seemed important, personally and globally. So I got trained up in cardiovascular physiology, and then did a PhD in cardiovascular pharmacology, then started to look at upstream determinants of health, like psychosocial determinants of health, uh, and cardiovascular health in particular. And then at the same time, I was learning a bunch of mindfulness skills through Zen Buddhism that really just helped me kind of self-regulate better. And as we started to do some research sort of at the intersection of mindfulness and cardiovascular health, we started to really get a signal there. And I wondered if we could maybe create an adapted program that would take the skills that are developed in mindfulness training, like self-awareness and emotion regulation and attention control, and direct those skills towards people's relationship with the major drivers of cardiovascular disease and hypertension, like diet and physical activity and medication adherence and stress and alcohol use. And so that's really how MBBP was birthed, with the help of funding from the National Institutes of Health. I think one of the things that I'm interested in that really helps me as I offer the talk today is to really like understand why you are here, each and every one of you. And so it's noon on the East Coast, but I know there's someone here even from Scotland, for example. But I would be interested if you'd be willing just to type into the chat box really why you're here, like what drew you to be here for this hour, and knowing that what you type in the chat box will just be seen by Fran and me, so it's pretty anonymous. And I'll read out a few examples that I think this just helps. One, it helps me understand where everybody's at, but also it helps us to build a bit of a sense of community where we're all having this shared experience now. So if you'd be up for just sharing, what drew you here today, in the chat box, I'd appreciate that. And so I'll just read some of the things off. One is to, hear about an adapted program, to learn how to enhance my health through mindfulness, to help control my blood pressure, to help others, better life enjoyment and high blood pressure, curiosity, looking for ways to improve overall health and manage stress. Uh, Very interested in the evidence base for mindfulness-based interventions, concerned to prevent a stroke. Someone lost their husband to advanced heart disease recently and wanted to learn more so I can live longer for our sons. I'm sure that I'm not super healthy. My dad died with dementia in October, and I'm scared of getting dementia, and hypertension and cardiovascular disease are predictors of that. So why don't we, it's also sort of like that time of year, New Year's resolutions and all that stuff that can be a time for like a new opportunity. And so here in, gosh, thanks for everything you've shared. We've got like 100 messages in the chat box about. Um, so, I'll keep this in mind as I'm presenting today. What I'll do first is just share with you a little bit about what mindfulness is and what some of our findings are with the mindfulness-based blood pressure reduction. I'll talk about what some examples of some of the components of the MBBP program, and then lead you through an example practice that is consistent with what we'd offer in the program. And as if you have any questions that come up, just drop them in the Q&A box. So I'll just share my screen. Sorry. Okay. So yeah, so probably a lot of people here know what mindfulness is, but I'm assuming that probably not everyone. These are some common definitions of mindfulness. One is that it's, this awareness that arises from paying attention on purpose in the present moment and non-judgmentally. So it sort of has like a couple different pieces to it. So one is like paying attention to this present moment, like paying attention to like our thoughts and our emotions and our physical sensations. But another piece is like the quality of that awareness or that attention, that it's non-judgmental. There's curiosity there, kindness, gentleness in many ways. I often think of it as we're just like a scientist watching the data come in. Can we respond skillfully to the data that comes in through our senses, like through our sight, sound, smell, and touch, and our thoughts, our emotions, because our pretty much the entire human experience is through, our thoughts, emotions, physical sensations. And so can we just be attuned to them in this present moment? Another piece of mindfulness is the concept of remembering. Sometimes it's translated as like remembering to be in the present moment. One of the translations that I most appreciate is remembering to bring our wisdom into the present moment. And so wherever we get our wisdom from, whether it's from things that we've read or close friends or family members or wisdom from our own hard-fought experience, doesn't really matter if we have it unless we apply it right here, right now. And there's even wisdom around drivers of heart disease and cardiovascular health and hypertension. And so can we bring our wisdom to this present moment around what really influences our health too? So those are some of the pieces of what mindfulness is often considered. When we were looking at, say, blood pressure or cardiovascular health as a whole, um, one of the things like with mindfulness or bring our wisdom to the present moment is we already know a lot about what drives hypertension and heart disease. So there's things like physical activity and weight loss, diet, alcohol use, stress reactivity. There's a lot of good medications out there for blood pressure. And so if mindfulness is going to influence blood pressure, there's a pretty good chance it's going to operate through the major drivers that we know about. And there might be some other drivers too. That's definitely possible. But we started from the place of really looking at what the evidence base is and then how could mindfulness training engage with that. And so one of the things that mindfulness training appears to do is to help with like basically self-regulation, like that top blue box there. And so that it can help us, like say, with our self-awareness. So really becoming more attuned to what our thoughts are sharing, knowing that they're just thoughts that we don't necessarily need to act on unless we choose to, or to be more aware of like our emotions and really the wisdom and the messages that are there, and then to respond skillfully to the emotions that appear or to our sensations. And so we really train people up in self-awareness through meditation and mindfulness training and in the mindfulness-based blood pressure reduction program. We also train people up in attention control. So with a meditation, we're often training ourselves to be right here in the present moment and to focus on one particular thing. Maybe it's the breath, or maybe it's another part of the body, like say the palms of the hands, or maybe it's just sound. But whatever that object of meditation is, doesn't necessarily really matter all that much. It's just, can we train ourselves to place our mind where we choose to, so that then in the future, we're better at doing that, so that we can be right here, right now with like the meal that we're eating, the person that we love, right here with our job, right here with our life. Uh, and and then also training in that emotion regulation side of things. So often it's mindfulness training can almost be like an early warning, like stress detection system, and then provides us with some skills to be able to really acknowledge the stressors that arise and also to skillfully engage with them when it happens. So basically what we do in MBBP is we train people up in those basic skills of self-regulation, of self-awareness, attention control, and emotion regulation, a lot through the mindfulness-based stress reduction curriculum. And then we direct those skills towards people's relationships with the major drivers of hypertension, so that we have very specific modules on, mindful eating, mindful physical activity, bring our mindful awareness to our relationship with our medication use, with our alcohol use, with our stress reactivity. And, there's so many ways to bring blood pressure down that we really invite people to kind of self-reflect on where they want to go. people receive like a self-assessment on their levels of all these different drivers of blood pressure at the beginning, and then they get to choose what path they want to go down. And we support them to go down that path. So like we had one participant, for example, during the MBBP program, like he circumnavigated Vermont on his bike, like during the program. Like the dude did not need more physical activity, but he did have a pretty stressful job and wasn't happy with how he reacted to stress. And his salt intake was higher than ideal. And so he worked on those two things. And I ran into him a few years after the program, actually, and his blood pressure had continued to stay down. And so we let people choose what path they want to go down, and then support them to go down that path. We've run the program through a couple clinical trials, so here is an example of, our findings on self-awareness. So if we felt we were proposing that mindfulness training could influence self-awareness, and what did it actually do? And so here we use this. It's called the multi-dimensional assessment of interoceptive awareness. But what we found, that green line there, is people going through the MBBP program and found that it went up quite nicely over the 6 months follow-up compared to the control group that didn't have much change at all, significant differences. When we looked at its impacts on blood pressure, we found a pretty nice reduction in systolic blood pressure, in this case, holding 6 months follow-up. So it came down about 6 millimeters of mercury systolic blood pressure. About a 5 millimeter mercury drop in systolic blood pressure translates into about a 10% drop in cardiovascular events like heart attacks and strokes. So it's a clinically meaningful reduction. When we looked at some of the health behaviors, so for example, diet, this program, we invite people to, use their wisdom about what diet is best for them. There's so many different ways to eat, and I want to really acknowledge what people's preferences are and their cultural values around it. One of the most evidence-based diets that we provide the information on is what's called the DASH diet. It stands for the Dietary Approaches to Stop Hypertension. So it's specifically developed for people with hypertension. So we tend to, show it, and it's similar to a Mediterranean diet. It's like a lot of fruits and vegetables and whole grains and legumes. So we found that people that had pretty low DASH diet scores at baseline, quite nice improvements in the DASH diet over time. And then similar with sedentary activities, like sitting minutes, for example, found nice reductions in people's amount of time that they were spending sitting. Another piece that the American Heart Association is really emphasizing right now is what we call like cardiovascular health. So it's this idea that it's not just cardiovascular disease, but how to be really, really healthy. And so this is a measure of like 8 different outcomes, like people's diet and physical activity and their lipids and blood pressure and body mass index and sleep, glucose regulation. So we had a lot of these measured in the study, and found that not only was blood pressure improving, but actually overall cardiovascular health was improving too. And then also, from a mind-body perspective, folks in this study, their depression symptoms weren't that high on average. Most didn't have like clinical levels. Some had some subclinical levels, but everyone is somewhere on a continuation of depression symptoms. They might be really low or they might be really high, but we're all somewhere on that continuum. But in the over 200 participants that were in this study, those going through the mindfulness training program did have a significant reduction in their depression symptoms compared to the control group too. So it's that idea of really whole person health, that so many health determinants funnel through blood pressure. In fact, that's one of the reasons why I chose it as a primary outcome. But at the same time, not to lose the forest for the trees, that in many ways, a lot of us are here to be healthy and happy. And so what kind of programs can help with that whole person health? And there's some evidence that the mindfulness-based blood pressure reduction program is doing so. We were able to, in another clinical trial, follow people up over 2 years, and found that the effects on blood pressure did hold 2 years follow-up, holding about 6 millimeters of mercury, where we did see in this study a lot of the action was in people with the highest levels of blood pressure, like systolic blood pressure over 140 millimeters of mercury. But in our other randomized controlled trial, we saw more equitable effects, both in people with, stage 2 hypertension or uncontrolled hypertension, as well as hypertension itself, and even just elevated blood pressure. So anything over 120 over 80. Those are some of the findings that we've been seeing manifest so far. And so maybe just kind of let that settle for a moment, and then we're going to shift into like an opportunity for a little bit of practice. So let me just check my notes here for a second. Check our timing. Okay, we're good. So, just like to give you an example of like, it's one thing to like see these graphs and stuff, but really like what's going on in the classroom, and so with MBBP, it's time matched MBSR, so it's 2.5 hour sessions once a week for 9 weeks, plus we have an all-day retreat on a weekend that's like 7.5 hours or so. So it's not an insignificant amount of time, but it's not an insignificant amount of change in health that we're going for. And so when people come, it's like it's group, it's live group sessions, either online or in person. And we'll often do some of the basic trainings at the beginning of just basic meditation training, what we call like attention control training, learning how to find an anchor point and to really focus in on it, to do body scans, to really understand the messages that are coming from the body, and to be able to keep our mind focused on each and every part of the body. We'll do training in what's called open monitoring. So really training ourselves to disentangle our thoughts from our emotions, from our physical sensations, and see what kind of messages are there. We'll do some basic mindful movement training as well. So in many ways, it's like we're building the foundation of a house that takes some time to build that foundation. But if we build it really well, then we can create a lot of customization and beauty from that foundation, which is where we get into pretty early on in the program. We're starting to adapt. So say, for example, we'll invite people to bring some kind of food to the program. Like if it's online, if it's in person, we'll bring the food ourselves. But it's usually some kind of challenging food. And so it might be something that we personally have some challenges around that's not overwhelming, but we maybe have some craving or some aversion towards. So maybe it's like brownies or chocolate chip cookies, or maybe it's bags of chips, or actually maybe it's like healthy foods like carrot sticks or something that we maybe have some aversion towards. We know we should eat it. Or maybe we even choose to like not engage eating during that practice as well. And that in itself can be empowering. And so then we start to take that food and to really be there with it, with the smell, the taste, the touch, the sight of it, and really start to notice how it makes us feel and the experience of it. And so it's sort of an example of, we can do like a mindfulness meditation, like with a neutral object, like a raisin or something. But in life, we're surrounded by, pretty tasty food all the time. That's from depends on where we live, but like shelf stable food, like bags of chips and sodas, are relatively inexpensive. And 75% of Americans, for example, deal with overweight and obesity. And if that's something that you're working with, you're by far not alone. In fact, you're probably in the majority. And so how can we just kind of notice with some kind of challenging food how it makes us feel? And then in doing so, often it creates conditions for insights to arise on how we want to engage with that food. Like, for example, we had a participant go through our program who lost like 18 pounds. And I talked with her actually some years after going through the program, and she shared how just like I had a habit of going to one of the well-known like coffee store chains and just getting like a sweetened coffee most days. And it was just kind of like a break. And as she went through the program, she started to really notice the flavor of the sweetened coffee and realized she didn't actually like the flavor that much when she really was there with it. It was kind of like almost sort of artificially sweet, and also didn't really like how it made her feel. And once she had that insight, she no longer desired the sweetened coffee. And she found that mindfulness became almost like a shield for her, where she would often get inundated with like marketing messages or messages about how she should eat. And it became almost like a shield for her, where she could just say simply, I don't like that food. And people would generally respect that. And and in doing so with those kinds of strategies, she was able to bring her weight down, 18 pounds or so. And so it's sort of that sort of an example of where we're training ourselves to be there with this particular challenging food and just notice what arises, what kind of insights perhaps arise, and then we can act on those insights. We do similar things like with physical activity in class, for example. And so there's as many ways to move as there are people in the world. And so we do some contemplations around, how do our bodies like to move? For some of us, we like it to be super practical, like yard work or housework, and others of us like to be a walk with like a friend and have some social connection. And others of us, it might be some kind of larger group engagement, can be anything. And we all have different limitations in our body and different environments that we live in. Like it's cold out there today, for example, in Providence. And so we just come to be with what is in our bodies, in our environments, and our neighborhoods, and then see what makes sense around engaging in physical activity if it's something that we want to do. And then we invite people to engage in that physical activity, whatever it is, monitoring their thoughts, emotions, physical sensations before, during, and after the physical activity. And just about everybody feels good, better after physical activity. And so we start to notice how this present moment is influenced by prior moments, including the physical activity that we got, what we ate, how much alcohol we drank last night, how much we yelled at that person on the drive to work. And so in doing so, it can create those insights that we can then act on with our enhanced like attention control that comes through the program. So those are some examples of like some of the modules in MBBP that we offer folks to be able to take those skills of attention control and self-awareness, emotion regulation, and apply them to the major drivers of hypertension and cardiovascular health. Um, so why don't we start to shift over where I will offer us an opportunity to engage like in a little bit of like a mindfulness practice. And so totally optional. If you don't want to engage in the mindfulness practice, totally don't have to. Um, but if you'd like to, the invitation would be to do that now. And so what I would suggest would be to just find a position that's fairly comfortable, that also promotes like alertness. So I often think of like maximizing those two factors, both comfort, but not so comfortable that we fall asleep, and then alertness, but not being so uncomfortable to be alert that we actually start to focus on our chronic pain or whatever's there. So it's just finding a position that's both comfortable and fosters alertness. Um, and and then, for those who haven't meditated before, there's often a question of like, what do you do with your eyes? And so in many traditions, the invitation is to have the eyes most of the way closed, with maybe a little crack open to allow a little bit of light to come through to activate the photoreceptors in the eyes that promote some alertness, but it doesn't feel comfortable to have the eyes closed. The invitation is fine to have them open, but maybe look at something pretty blank, like a blank wall or nature. Looking at nature can be just fine. I often meditate just looking at nature. But mainly trying to remove some of the visual distractions. So just settling in for this mindfulness practice. If you like, allowing the eyes to close if you're comfortable with that. And then the invitation would be to start to find your way to an object of meditation, or I often call it like an anchor point, and that it's an anchor that we can come back to no matter where we are in our day. And so Could be our breath, for example, like the in-breath and the out-breath. But not everyone is comfortable with the breath. Maybe, for example, if you have asthma or something, and if you prefer not to be with the breath, you could choose, say, another part of the body, like say the palms of the hands or the soles of the feet, and just be there like with the raw sensations in that part of the body, like maybe it's of warmth or coolness or moisture, dryness, touch, lack of touch. And for some of us, it's like not a comfortable thing to be with the body, and if that's the case, it's okay too. And the invitation would be to choose like object of meditation, such as like say sound. It's a little bit more outside the body, but it would just be the raw elements of sound, like say the pitch or the volume or how near or far away it is. So inviting you to find your way to an object of meditation that you'd like to engage with, of either the breath or a part of the body or sound. Meditation is just like with kindness, some firmness, just inviting the attention to dwell with that breath. Maybe if it's the breath, maybe you're focused on a particular spot that feels the breath. Maybe it's the diaphragm, or maybe the tip of the nose where the breath first comes in and last leaves the body. So really being there with that object of meditation of the breath or the part of the body or so. Taking a moment to notice what the mind is. If the mind has wandered away, knowing that you're in the company of probably just about everybody here. So if the mind wanders, just noticing where it went. Did it go to the future? Did it go to the past? Does it usually go to the future? Does it usually go to the past? So this is enhancing our self-awareness, where the mind is in this moment. And then we're training ourselves in attention control by inviting us to bring our mind back to that chosen object of meditation of the breath, the body, or sound. Well, having the day that we're having, it's a busy one, but also knowing that in this moment we've got nowhere to go. Right now, we've got nothing to do. We're just stopping, calming, resting, being here with this breath or this part of the body or this sound, allowing the thoughts to just settle out so that all remains is breath or the body or sound. You like. Next invitation is an object of meditation. If you're comfortable with it, it's uh, fine not to shift. You prefer not to, but the invitation would be to shift and notice the physical sensations that are present in the body right now. It's kind of what kind of messages are coming. Maybe it's a sense of pressure of your sit bones on your chair, or maybe it's some kind of ache or pain, or maybe it's some part of the body that's actually feeling pretty good. Just tuning into the physical sensations right now to see what's present. Just knowing if it's ever like overwhelming to be with those physical sensations, it's fine to just return back to your anchor point of the breath or a particular part of the body or so. Meditation, if you like, would be to just actually connect in, like with the thoughts in the emotional tone. Just see what's here. Emotions are present. Is it peacefulness? Is it agitation? Is it tiredness? What kind of thoughts are going through the mind? We don't need to act on any of those thoughts or emotions, but just noticing what's present, meeting them with kindness if you can, compassion. Thoughts or emotions shift over time or if they're steady. So you're ready, inviting you to return back to your anchor point that you began with of either the breath or a particular part of the body or sound. So this meditation starting to come towards a close. We'll just end with connecting back to where we began. Good. Inviting the eyes to begin to open as the meditation has come into a close. The eyes have been closed. And then kind of keeping in mind like our physical sensations, emotions, thoughts that we've just been connecting in with, and that kind of present moment awareness. And then also connecting to like what drew you to be here today with the talk on sort of the intersection of mindfulness and cardiometabolic health, blood pressure. Invitation would be to just even ask yourself, like a little contemplation of, uh, you know, what is it that you most want related to your cardiometabolic health or your blood pressure? Like, for example, if you were to pick one thing to work on related to like your cardiovascular health, what would it be? Do this kind of contemplation in MBBP. One of the ways that we frame it is it's almost like kind of connecting in with ourselves about just who we truly are, or what is our almost like our fundamental true self, and can we just allow that out? And sometimes things get in the way of that. And is there anything that is in the way of that that you would like to offer to yourself as one particular thing that you'd like to work on related to your cardiovascular health, and what would that be? And so then what we do in MBBP that I'll offer you is actually like called an action plan, but I'll put it in the chat box of the first question is, inviting you to set an intention or like a goal that you feel would support your well-being at this moment in your life. You don't have to do this, but just an invitation to do that if you'd like to really set like a kind of like a measurable, like pretty specific goal, like whatever it is. So you can take a moment to think of what that is. You could write it down somewhere if you like. And then the next contemplation that I'll also put in the chat box is on a scale of 1 to 10, where 10 is high, how motivated are you to actually achieve that intention? So we often want to set goals that are like pretty doable. And so this is like a little test of really like how motivated are we to do that? And thanks for those of you that are responding in the chat box too. It's fun to see. And then the next question is that I'll put in is on a scale of 1 to 10, how confident are you that you'll achieve that goal? And if you're less than like, if you're like an 8 or less on either of those, the question next is, put into the chat box, is like, what could you do that would bring your motivation or confidence a little higher? Could even jot that down somewhere if you like. So in many ways, we're kind of like testing this here a little bit and helping offer ourselves these self-reflection questions that can make things get a little more real and realistic. This question would be, what might make it difficult to achieve this goal like this week? And if that happens, what will you do? So it's one thing to set a goal, but then things can get in the way. And so what do you think might get in the way of it? And if it does, what are you going to do? See, not everyone's seeing the chat box questions, but if it's basically just what I'm sharing verbally. So you can just kind of let it settle in a little bit too, if you like. And lastly, the last question that we have is, what is a way to measure this intention that resonates with you? So sometimes what we measure, we could move.
Eric, I
So
think if you
yeah.
are able to use the drop down to chat to everyone instead of host and panelists.
Oh, that's right. I'm sorry. Yeah.
Okay.
Yeah.
And one thing we could do is as we switch gears to having me share my screen and I can go fairly quickly, you could repost those questions so folks can have those written down.
Yeah. I
Perfect.
just posted them now to everybody, so got them there. So that's something that we offer, that module we offer actually a few weeks in a row as we get into the MBBP program, just to like, again, make it real that a lot of us know what to do to help with cardiovascular health. It's just, it's hard to do it. And a lot of society isn't set up to support us to do that. And it seems that mindfulness training may help us really tap into the fire within ourselves to really, with that self-awareness of our emotions, thoughts, physical sensations, to be like, I want this. And to help with the attention control to be able to then act on those insights that arise. And so the program's designed to set up to do that. So yeah, so Fran, what's next on the?
Yeah, I'll share my screen and kind of I can go through. I mostly want to present the dates for the upcoming blood pressure course. And I'll also let me put into the chat our website so you can see more about other programs as well. Here is okay, so let me switch gears. You see that okay?
Yes.
Okay, great. So yeah, thank you so much, Eric. We really appreciate the personal invitation, call to action as well. And um, that is much of what the course really allows is the space to kind of devote to not only training in on mindfulness, but also kind of really personally identifying points in areas in your life that where you can, apply those mindfulness techniques and hopefully lead to more long-lasting behavioral changes. So I appreciate that. Thank you. And thank you to everyone who shared in the chat the personal reasons for why you're here today. So at this time, I'm just gonna go quickly through our course offerings. So if you visit us on our website, which is the link that I shared in the chat, you'll see that we offer a number of short 8-week mindfulness-based courses, which includes the mindfulness-based blood pressure program that Eric presented on today. But we also offer mindfulness-based stress reduction, or MBSR, which is really kind of the gold standard and one of the first mindfulness-based programs to be offered in Western society, and now it's taught all over the world. And then 3 adaptations of MBSR, so mindfulness-based cognitive therapy, or MBCT, which is an adaptation of MBSR that is designed to really help individuals struggling with recurring difficult mood states such as depression or anxiety. And then we also have the blood pressure program, and then Finding Peace in a Frantic World is a shorter program that I can also present to you today. But first, really looking at the blood pressure course, I want to make sure everyone gets a chance to see these dates. So our next mindfulness-based blood pressure program is actually starting up end of February. And so as Eric mentioned, it's an 8-week course where you have an orientation session at the end of February on February 26th, and it's going to take place Monday. That should actually be Wednesday evenings, correct, Eric?
Yes, that's right. Yeah.
Yeah. So Wednesday evenings, 6 to 8:30 p.m. Eastern Standard Time, you'll have the orientation session, and then you'll have a week off, and then it'll start up and have the 8 weeks. And you come to class once per week for 2.5 hours per each session. And then there's also an all-day session around week 5 of the program. And we have the great honor of having Eric is going to be teaching this winter's MBBP class. And so it's a real great opportunity. If you're thinking about taking the class anyways, this would be the time to do it. I won't spend any time on this other to say that the Finding Peace in a Frantic World program is a shorter mindfulness-based offering. It's just 1 hour per week for 8 weeks, and rather than having the all-day session or the orientation, it's just a lunchtime offering, 1 hour per week. So if you have a very busy schedule, or you're not sure you can commit the full 2.5 hours, that might be a nice alternative. And that also, it's not too late to sign up for that class, and starts up on January 23rd. And I won't spend any time on MBSR and MBCT other than to say that our winter sessions have actually already launched this week. And so we're now enrolling for spring sessions, which start up the first week in end of March, early April. These classes fill up quickly, so you can see that we do have quite a few options for that, including an in-person MBSR class. So if you live local to the Rhode Island area and you want to take an in-person mindfulness-based class, that would be the one to take. We probably we really only offer in-person sessions like once or twice a year. So we have one this spring, and I don't know when the next time it will be. So there's that. The other thing I wanted to show, we have teacher training certificate offerings, both in MBSR and MBCT. You can check that out online, as well as custom programs for organizations. We have some upcoming events that you'd be welcome to check out. We're launching a speaker series this year on the evolution of mindfulness, which is starting out with John Kabat-Zinn. We'll be talking, who's the founder of MBSR. We'll be talking on January 27th. I can put a link while we're doing the Q&A session, I can put a link to that talk to register for that if you haven't already. And then I also want to say that we are able to offer a one-time discount code for mindfulness-based blood pressure program. So if you want 15% off, this will expire tomorrow and really is only being offered today. So there is the discount code there, MindHeart15. And if you go to register, you'll see there's an option to enter that discount code there. Otherwise, at the end of the talk, when we send out the link to the recording, we also offer a standard 10% discount for attending today's session. So I don't want to take any more time presenting on this. I want to get back and save some time for question and answer. So let me stop sharing my screen. And Eric, I don't know if you had a chance to review some of the questions that have come in. There are quite a few.
Yes. Yeah.
What do you?
Yeah. Thanks for all the questions that came in. One person shared, does age not allow for a higher perfect reading than 120? And so for a long time, it was thought like age was one of the sizable drivers of blood pressure. And it's interesting that more recent research is actually suggesting that may not be the case. That if you look at cohorts of people that have followed over time, that those that have the healthier profiles of cardiovascular health don't tend to get an increase in blood pressure. And if you look at societies that have not encountered as much like industrialization, there's often not much in the way of hypertension in those societies across different ages. So it's an interesting time. I used to think, age and genetics, what are you going to do? And now it's more, in my opinion, genetics. But the genetics are always interacting with the environment. And so hypertension rates have really gone up in over the last 60 years, but our genome hasn't changed much. And so there's the interaction of some of us have a higher genetic predisposition, but it's interacting with that environment. And so can we use the mindfulness skills to understand our environment and what are maybe the major drivers of it, and then how to engage? And one person asked, what if I live in a family environment where folks around me aren't so healthy, and what do I do? And also like around, say, trauma history, for example, too. And so a lot of programs, including this one, is like trauma informed, so that we always have like ways to be able to kind of like pendulate into like just noticing our thoughts, emotions, offering lots of alternative, like say the anchor points that we offered. Someone had trauma related to their breath, for example, like a choking incident. We always have other alternative anchor points now, like the palms of the hands, soles of the feet, sound, for example. Our environment does influence our blood pressure, including our social environment and our family environment. And so if that's the case for us, you're in good company. I think, in our program, we do have elements of like bringing mindfulness to our social relationships, including conversations that we can have with others. So there may be opportunities to engage in with our family members around us to share, I want to be here to take care of you for many, many years. And here's one of the ways that I can better care for you. And what would you think if, the cookies always lived in this cupboard so that I don't have to see them? Or, we're not always in charge of like our food preparation, for example. And so it's challenging, at least for me. I take the lead more on my food preparation, but I've also talked a lot with my wife, and it's sort of, we've kind of co-inspired each other to like create more healthy menus, but not all of us are living in those kinds of family situations. Sometimes I find it's like, it's going to depend on the individual and the family that we live in. But part of the mindfulness training is to connect in like with our own wisdom, and what is our wisdom sharing around what's the best way to engage with this particular social environment that we're living in, and to trust the wisdom that comes up with that about how to navigate it. And in the program, we talk through that kind of stuff as it arises, so we can get a bit more customized to each individual's scenario. There's a question about, is there a place to access the published results of the MBBP study? So if you just Google mindfulness-based blood pressure reduction and say my last name, I think all of our papers are open access. So there's one in like JAMA, like Journal of the American Medical Association Network Open, another one in the Journal of the American Heart Association, both 2023, American Journal of Cardiology last year. There's quite a few out now. How are we doing for time? I don't know, Fran, if you saw other questions that came up that would be particularly good.
Yeah, wondering if you could speak briefly to, with MBBP being an adaptation of MBSR, what are the main differences
Yeah,
between the two programs?
right. Yeah, I would say it's about 65% the same as MBSR. So basically what we did is we kind of shaved 5 to 10 minutes off pretty much all the modules in MBSR to create these very specific opportunities for folks to be able to take the skills in MBSR and apply them to their relationship with their diet, to their relationship with medications, to their relationship with physical activity. MBSR already deals with stress quite well, and we bring that in, but it doesn't deal so well with diet or physical activity or alcohol use, for example, or antihypertensive medication use. So we have specific modules on that. We do more intention setting and action planning than MBSR does, so we're a little bit more explicit about that. And we also have people like measure their cardiovascular health, the baseline, and then again at follow-up to see how things shift. We also do more small group work. So for folks that are working on physical activity, you're all in a small group with each other to kind of talk about how things have been going and where you're at, and those working on stress are in another small group, and those working on diet are in another small group. And with our in-person programs, we found that friendships have developed, that folks, are walking together like months, years later, continuing to support each other too. So there's elements like that that are particularly unique to MBBP because it's blood pressure reduction. So that's its main focus compared to mindfulness-based stress reduction, where stress reduction is a major focus of it. So those are some of the bigger pieces. Someone mentioned my diet and physical activity is already pretty good, but I still have high blood pressure, and that's the case for some of us too. So we explore into all the different drivers. We had one fairly young person who had quite high blood pressure, and so we worked with her to, we all have high blood pressure for a reason. It's not magic. And so what is it? And in her case, she kind of got a workup with her physicians and found that she had a benign tumor on her adrenal gland that was releasing out a lot of adrenaline that brings the blood pressure up. And she was able to get that surgically repaired, and her blood pressure came down. So mindfulness in a lot of ways is just trying to see the truth. And so what is the truth of why my individual blood pressure is up? And then once we understand the truth, we can then act on it. And so we're supporting participants to see what it is within themselves that's the major driver, and then to support them to act on it. Good. Hope to see some of you in the program. If it's a good fit for you, no pressure, but I'm excited. I haven't taught this program for some time now. We've had other teachers providing it, but I'm excited to engage in with whoever would like to be there. Maybe get an opportunity to meet some of you if you come.
Thank you so much, Eric, and thank you everyone for making space in their day. We'll send out an email with the link to the recording. And if you still have questions about the program, feel free to email us at execeducation@brown.edu. You can find that online as well. Otherwise, we look forward to hopefully seeing you at some of our other upcoming events, and hopefully some of you will join the blood pressure class as well. All right, take care, everyone. Thank you.
Bye. Thank you.
Bye.